In this session, we will be discussing about the scrotum. Scrotum is an integumental pouch in lower part of the anterabdominal wall. It contains testis and lower part of the spermatic cord. It covers and protects testis. Maintains lower temperature for testis than the intra-abdominal temperature because lower temperature is appropriate for spermatogenesis. Scrotum is bilateral in development. It is formed by fusion of two genital swellings represented by a median raphe. In females, genital swellings remain separate and form the labia majora. Left half of the scrotum is slightly lower than the right half to accommodate elongated left spermatic cord. The layers of scrotum are skin, dartus muscle, external spermatic fascia, cremaster muscle and fascia, internal spermatic fascia, and parietal layer of tunica vaginalis. You can see here, this is the skin, this is the dartus muscle, this is the external spermatic fascia, this is the cremaster muscle and fascia, this is the internal spermatic fascia. On lining this only, there will be parietal layer of the tunica vaginalis. So skin is thin, elastic, pigmented, corrugated. The corrugation is due to adhesion with the underlying dartus muscle. Sweat glands are present. Sebaceous glands are present. So that's why it is potential site for sebaceous cysts. You can see this is the skin. The skin of the anterabdominal wall continues with the skin of the scrotum. Dartus muscle, subcutaneous involuntary muscle. So at median raphe projects into interior as scrotal septum, which is attached above to the facial sheath of the root of the penis. Dartus muscle is continuous in front with the fascia of Camper and fascia of Scarpa of the anterabdominal wall, and behind with the fascia pollis of the perineum. It is supplied by sympathetic nerves from superior hypogastric plexus. Subcutaneous fat is absent in scrotum. It is replaced by dartus muscle, which helps in lowering the temperature. You can see this is the dartus muscle. If you see this, see the continuation with the Camper's and Scarpa's fascia. External spermatic fascia, it is derived from aponeurosis of external oblique muscle, begins from superficial inguinal ring. So this is the external spermatic fascia. Cremaster muscle and fascia, it's a detached part of internal oblique muscle, origin, upper surface of the middle third of the inguinal ligament, passes as muscle fasciculi along the spermatic cord. In scrotum, it spreads as series of irregular U-shaped loops held together by areolar fascia. Insertion, ascending limbs form a narrow tendon and inserted at pubic tubercle and pubic crest. Nerve supply, it is a genital branch of the genitofemoral nerve. Action, pulls testis towards the superficial inguinal ring. You can see here, this is the cremaster muscle and fascia. Internal spermatic fascia derived from fascia transversalis, starts from margin of the deep inguinal ring. You can see here, this is the fascia transversalis, which is continuing as the internal spermatic fascia. So transverse abdominis does not have any extension into the scrotal layers. Parietal layer of tunica vaginalis. Tunica vaginalis develops from distal part of the process vaginalis of the peritoneum. It has two layers. Parietal layer lines the inner aspect of scrotum. Visceral layer lines testis and epidermis except posterior border. Both layers enclose a closed vaginal sac. Accumulation of fluid in the sac results in hydrocele. You can see here, this is the parietal layer and this is the visceral layer of the tunica vaginalis. So this is the vaginal sac where fluid can accumulate resulting in hydrocele. You can clearly see here, this is the appendix of testis and this is the appendix of epidermis. This is the spermatic cord with the vas. This is the epididymis, head, body and tail. This is the mediastinum testis. These are the lobules of the testis with the convoluted part of the seminiferous tubule and straight part of the seminiferous tubules uniting to form the rete testis. From upper end you can see the efferent vacuoles entering into the head of the epididymis. Arterial supply. Scrotum is supplied by femoral artery branches, namely the superficial external pudendal artery and deep external pudendal artery. And branch from internal pudendal artery is the posterior scrotal arteries. Venous drainage drains into great saphenous vena and internal iliac vein. Lymphatic drainage into the horizontal set of superficial inguinal nodes. Nerve supply. Anterior one-third is supplied by the L1 segment through ilioinguinal and genitofemoral nerve. Posterior two-third is supplied by the S3 and S4 segments. Posterior scrotal branches of the pudendal nerve and perineal branch of the posterior femoral cutaneous nerve. See the discontinuity between these two. Anterior one-third L1, whereas posterior two-third S3 and S4. So they indicate the starting point of the anterior axillary line of the lower limb. Thank you.